As I was also today, I was also taking the breakfast in the Alpine hotel, and then I left the Alpine hotel, and I came just outside the emergency department of the Karnali Academy of Health Sciences, and I observed something different. The 4 to 5 guys holding one patient or one guy and compressing his head, and one of the guy compressing his left ankle with some uh, cloths were uh, brought in front of the emergency department of the cars in the uh, auto, and then immediately they lifted the boy and enter inside the emergency department of the Karnali Academy of Health Sciences. Then I also entered the department, and I still noticed they were shouting with saying emergency, emergency, and emergency. They were shouting, saying the emergency, and one of the medical officer and nurse immediately responded to them, and they put the patient in the resuscitation area, that is resuscitation bed, and immediately after that the nurse and the medical officer, they both looked for the patient. They asked for the patient's name to assess the GCS. Simultaneously, nurse was opening the vein in his right hand. The patient was responding, but a little bit in a pain. He was shouting with a pain, and there was a lacerated wound over his head and his ankle, and there were various wounds all over his body. I don't know what was the case. I was wondering whether the case was of a road traffic accident or something gang fight. Simultaneously, the one of nurse joined the probe on his right hand's index finger to monitor the vitals, and she also took blood pressure of the patient. Simultaneously, the medical officer was compressing the wounds with the gauze pieces to stop the bleeding from his left ankle and from his head. Now, till now, we don't have any idea. Better to say, I don't have any idea whether the patient was of road traffic accident or a gang fight or something else. But after asking the patient, he said that this was due to the bear attack. Yes, bear attack. I have never imagined the case was of the bear attack, and simultaneously they were administering the fluid via the opened vein. They put the green colored cannula first and then administered the fluid. Then after the dressing was already applied on the patient's left ankle, the wound near the left ankle, and the pant of the patient was too tight, the trousers were too tight, and they asked for seizure, and they got it out. Now, immediately the vitals were monitored, and they are normal. Yes, and the blood sample more. I'm submitting it to the lab. This is the blood sample. Ordered for some medications and asked the patient party to pay for the bills, and one of the medical officer at the station also ordering for the NCCT, and they also asked for payment of the bills. Now the patient was quite stable. Now one of our resident doctor came in the emergency department, and they saw the case and performed the point of care ultrasound, that is E-fast for the trauma. While doing E-fast, really fast. I was also there, and there were no fluid inside the abdomen. There was no cardiac tamponade, and there were no any immediately life-threatening conditions. Luckily, there was no any wounds over the patient's face. I remember the one of the nurse also gave the injection of the tramadol via that opened vein via the green colored cannula. Now the patient was a little bit not in a. I think he was not enough in a pain, and the pain was relieved. Now the they assessed via the e-fast, and which was normal, and patient's heart rate, blood pressure, and the respiratory rate was acceptable, and now the patient was shifted to the uh, like emergency room for the approximation of the wound. I remember the wound was about like uh, 12 to 15 centimeter in length, and 12 to centimeter in the breadth, and which was lacerated fully, and the scalp was exposing. After that, uh, after that, while opening the cannula, the sister already collected the blood samples in 3 different vials. Uh, at that time, patient parties were busy in discussing something about the case, and they are worried. Then sister called me to submit it to the lab, and I brought those vials and the already paid bills by the patient parties, and I submitted it to the emergency department's laboratory. After that, the patient was the discussion was completed between the in charge and the one of the resident, and they called just to approximate the wound, and they brought the patient in the emergency room OT. Now in the emergency room OT, there was little bit bleeding, and patient was on the pain. We changed the patient bed, and the local injection, that is a local anesthetic, that is lidocaine with adrenaline, was injected over his lacerated wound and the wounds near his left ankle. Now the head was irrigated, the wound over the head was irrigated with the normal saline, because there was already blood clotting in the hair, and it was not possible to save without the irrigation. Then we irrigated the wound, we cleaned the wound, and the saving was performed by one of our resident doctor, and I assisted in that also. I assisted in doing the irrigating the wound with the normal saline, opening the normal salines, and I also assisted in bringing the seizure to open that normal saline. I also helped the resident doctor to inject the local anesthetic, that is lidocaine, from the lidocaine bottle, and then he injected it into the patient's head. After that, I still remember. I am remembering that the patient parties were worried because I don't know why peoples of this area, local peoples, do not have trust in this hospital. I don't know why. Whether this hospital have not enough skilled manpower, or whether the doctors are not skilled, whether they think this hospital is not going to give us the treatment, appropriate treatment, and they are worried. They are asking to refer the patient to the Nepalganj. And the in charge, I still remember, I am remembering, the in charge said that the case severe than that, which was on estimate of a female, we already treated, which was of the bear attack also, and she is stable now. And after seeing that, they were not convinced, and after some time they somehow, luckily, the patient parties were convinced that they are going to keep their patients in this hospital. Now, after cleaning the sutures in the head, after cleaning the wounds over the head, we applied, one of the resident doctor applied the suture over the head, and he approximated the wound. And after approximating the wound, I forget anything. Before approximating and applying the suture, we give the rabies anti serum, that is IVIG, to all the wounds in the body, that is wounds over his head, wounds over near his occiput, wounds in the neck, wounds in the foot near the ankle, and every wounds in the body that was injected with the IVIG for the rabies. After that, we applied the suture over the lacerated wounds and over the wound near the ankle, and the wound are approximated. I uh, Now the resident doctor called me for the mipirocin, that is a local antibiotic, and I opened the mipirocin and then handed it over to the resident doctor. He applied the that mipirocin over the wound, and then they closed with the like gauze pieces, and then with the roll bandage, and then with the crepe bandage. The crepe bandage was brought in the OT emergency room by the patient parties. 2 crepe bandages were ordered, and now the wound near the ankle was also similarly closed. And after that, the doctor allowed the patient parties to bring the wheelchair and shift the patient to the radiology department for the NCCT of the head. I remember how when patient came to the emergency department and patient parties were shouting for emergency, 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 and how the emergency team was activated, and they act simultaneously in the coordinated manner. The nurse opened independently the IV cannulations and gave the tramadol injection, and then administered the fluid, and then put the probe for monitoring the vitals of the patient. The doctor, one of the medical doctor, independently, he simultaneously but independently applied the pressure over the wounds and applied the gauze piece to stop the bleeding. Guys, now I'm in the pediatric hall waiting for the patient's CT scan report so that I can explore more about the case. And in the pediatric hall, I was writing the script and how the case was managed. I have previously uploaded the video, which was my first video of the case experience, and for that case, I have also speak without script, but I was not able to do that because for that case I was so busy, and I just studied the script on my iPad, and just for the experience I uploaded it to YouTube. But for this case I am shooting the video in the same day, and within 15 minutes I experienced the case. So guys, please give me the review, and I am you, as you all know, I am the student, and these videos are purely the students perspective and students experience about the case, because the previous case of the stab injury to the chest was also the first case, and this is also the first case. This is the bear attack which I hear for the first time in the hospital, and I have that opportunity to experience that case in the emergency department of CAS. So guys, watch it. I will upload this video in the YouTube. I will while by going home. After going home, and then I will upload my experience. It's not totally the like according to the guidelines or something else. It's totally about my experience, how I felt and what I observed. I am in the observership, and now this is the time for the same vacation, and all of my friends are at home. Most of my friends are at home, and about 10 to 15 friends are here, and I will discuss about this case with them also. Okay guys, I will upload this kind of experience and this kind of observational videos in the near future. Hope you guys subscribe, like, share, and give feedback in my comment section. Okay, guys. I also noticed. I also noticed that the antibiotic was also given. The injection for tetanus was also given. The resident doctor called me for the tetanus vaccine, and then I brought it from the freezer of the emergency department, and then injected the tetanus vaccine to the patient. After that, we had a IV green colored cannula, while a normal saline was being administered, that I put for the patient. And after that, the metronidazole antibiotic was also given via the IV route. Similarly, the patient parties were asked to brought the, I think, flucloxacillin antibiotic, which will be also administered. Till now, it is not administered to the patient. I am in the pediatric hall making videos regarding the experience of the case. I experienced the case first time, which was of the like bear bite. I am like in my early 20s, and I didn't have experience to watch bear in live in front of me, or something, the attack of bear like this case. Definitely, I think I had a new experience today. I have a new experience today regarding the polytrauma case management. The case was of the polytrauma. There was trauma over his head, his neck, his abdomen. There was a lacerated wound over his abdomen. There was a lacerated wound over his ankle. The patient was seeing there was a sprain over his left ankle, and they also ordered for the X-ray of the foot and ankle joint. Similarly, the non-contrast CT of the patient was ordered, whether there is any pathology, whether there is any trauma to the brain also. But while asking the history to the patient, he has no history of the vomiting or ENT bleed. But one thing is that the patient also said about that he was unconscious for a while just after the bear attack, because he was wearing the earphones. He did not knew about whether a bear is coming or whether a man is coming. He thought, now I am going to look for the report of the CT scan, whether it was normal. Being a student, I do not have any right, or I cannot do any procedures. So what I can do is just observe what is being done. I am going from the pediatric hall of the Karnali Academy of Health Sciences, and in the emergency department I look for that case and CCT the report. He has no idea. He had no idea till that moment. But so after that, he noticed the bear attacked him, and I think it was the grace of the God that bear did not kill him. The patient said after 45 seconds to 1 minute, the bear left him alive and run away. That's what it is. And while he was under attack, he was about 500 meters away from his home. Luckily, 2-3 people came, local people came, and they saw the patient, and they immediately rescued him from there, and they brought the patient to the emergency department of CAS. Without the perfect coordination, it was impossible for him to survive that attack. Okay, this is my second video regarding the case experiences. It is not possible for me to edit all those experiences and upload in the blog, but this case was interesting, so I uploaded this case. Hope you guys will like, share, and give me the feedback so that I can upload the videos. It is obvious that I have not much that vocabulary to explain in the type of storytelling, right? But I will try to upload the case experience videos like that in my YouTube channel in the future. So guys, whether you are a layman or whether you are a medical student or whether you are respected senior, please give me a feedback so that I could upload those kind of videos in my channel in the coming future. And we all in Nepal, the cases like of the bear attack are rare. We are in the uh, Himalayan region, that's why we are receiving those kind of cases, and it's uh, frequent. Those kind of cases are frequent in the Karnali Academy of Health Sciences. Our senior said about that. Okay, guys.